next up, we're going to move into a case study here on enhancing data literacy across your organization. So welcome Andre De Pena, Director of Data Strategy, Governance, and Analytics at the University Health Network, and Ashley Tattersall, Manager of Data Literacy and Analytics with the University Health Network. So welcome.
I want to channel my inner.
All right, thanks.
Ashley Tattersall, there we go. My name is Ashley Tattersall. I'm Manager for Data Literacy and Analytics at University Health Network, and I specialize in data literacy education, providing student learning opportunities in advanced analytics. I'll hand it over to my colleague Andre to introduce himself as well as kick us off here today.
Good morning, everyone. My name is Andre De Pena. As Ashley mentioned, I'm the Director for Data Strategy, Governance, and Analytics at University Health Network. So in my portfolio, I have teams that look after establishing what our strategy will be for the organization in terms of data and analytics, providing governance for all of the different data assets that you heard even Erica mention. We also are a very complex health ecosystem. Also advancing our Team UHN's data literacy across all our different hospitals in the network. And we also do a lot of advanced analytics projects, so simulations, data modeling, predictive analytics, to solve some of the challenges that healthcare faces in terms of staffing, but also in terms of providing patients with care. And then we also have, as Ashley mentioned, our learning program with institutions around us to provide the next generation of healthcare leaders with opportunities in data and analytics. And so really today, picking up from one of the slides that Erica had, we thought we'd share with you our journey and some of the recipe ingredients that we think are important in advancing data literacy in a large public sector organization. In our case, it happens to be healthcare, but the lessons learned are pretty applicable, we think, across the public sector in Canada. And so over the next half hour, what we thought we would do with you is go through the importance of data literacy. So you're all here, you understand that importance, but it will be helpful to just set some context in terms of why we think data literacy is important. And again, picking up on some of the things that Erica alluded to, it will help set the context for how you then go about implementing a data literacy program, perhaps in your organization. I know there's a lot of talk about AI, and so we thought we'd have some connection and help you understand how we are connecting data literacy with AI literacy, at least in a healthcare perspective, and then we'll end with some key takeaways for you at the end of our case study. So we'll start by just a little bit about UHN. I'm thinking most of you might know about University Health Network. We are Canada's largest health network. We are Canada's #1 hospital network. We've been providing care to our communities for over 200 years, so it's as old or older than the country in some ways, and we're a teaching hospital, so we also have the Michener Institute of Education attached to UHN. We're also a research hospital, and so we have 6 research institutes, and we are really there to provide care, so we have 12 different clinical programs from cancer care, cardiac, arthritis, I can't even think right now. Also, I would say in terms of multi-organ transplant, we're pretty big, and then also a whole bunch of outpatient care that's provided at the hospital as well. So at any given time, we have around 500,000 active patients in the network. In a year, we see about 124,000 admissions at our emergency departments, and every year, almost close to 1.5 million patients that are treated through outpatient visits, ambulatory care visits. So it is pretty complex. It is pretty big. There's a lot of data across clinical, corporate, research, and education domains. And then we have the task at hand to provide governance for all of that data, and then to help the organization actually start to use that data, make decisions with that data, tell better stories with that data, and analyze and interpret that data a lot better. And that's where data literacy comes into play, right? So I think this slide really reiterates our point that we have a lot of data, all of our organizations have a lot of data, but if you just have structure and policy and standards and governance, that's great and that's important, but that doesn't help people see the value. If you just have data governance for the sake of having data governance, as we saw in our case, people ran for the hills. And so we had to actually show value that we get from data governance. And creating that bidirectional connection between governance and value, that's where data literacy can help, right? So if you have your data and you can start to analyze that data better, interpret it better, communicate with it better, and make better decisions, in our case to impact patient care and hospital operations, then people see the value of investing in data governance. They see the value of improving their own data literacy and data fluency skills. And that's where our team comes into play, because then people understand the use case for why it's important to be a data literate, a Team UHN member, right? And so what does the research out there tell us? Because we understand that data literacy is important. So Forbes actually stated that data is the fuel that runs our fourth industrial revolution that we're all living and working in, right? The rapidly evolving data ecosystem that we are in. There's also research from DataCamp that says that in the last 5 years, 3 of the 5 fastest growing skills have been data-related skills. And then there's also research from a company called Forrester Research that says that 70% of employees across all sectors, not just the public sector, are expected to work really heavily with data as of 2025. And we're almost at the end of 2025. So we all agree that that's really the case. I think it's even higher than 70%. And most interesting, I think there's a company called Data Literacy Project who specializes in data literacy. And they found that while 87% of leaders, so across industries again, think that data literacy is an important skill, second only to basic computer skills, only 1 in 4 of those leaders, so about 25%, feel that they're comfortable and confident and competent in their data literacy skills. So a big difference in variation, right? 87%, almost 90% think that it's important, but only 25% feel that they're comfortable with their data literacy skills. So Gartner actually summarized this really well, and they said that a lack of data literacy skills in our workforce is the largest inhibitor to becoming a data-driven organization. And everyone here agrees that there's value in using data to not make your decision, but inform your decision and supplement or complement your experience that you bring to the table. So in the public sector, we find we're in healthcare and we're also in the public sector. We are trying to help our organization understand, and I know you all understand, that we have to start to look to our data as an essential resource the same way we look to our people as an essential resource. Like we depend on our teams and our colleagues to get us through a lot of the challenges that we face on a daily basis in our organizations, but do we look to our data to help make some of those decisions or inform those decisions? So being a data literate individual and a data literate workforce plays a huge role in making sure you're using your data as a competitive advantage and as an asset, essentially, at the end of the day. And it also helps us, at least in the public sector in healthcare, we're funded by the Ministry of Health and Long-Term Care, and we have limited funding every year, and that gets allocated across all the different hospitals across the province, and each hospital gets a small sliver of that, and then that's divided across the large hospital, and we get an even smaller slice of that. So understanding how we're funded, understanding how we perform, so the value that we provide back to the province and the communities we serve with that data is important. And we can only do that if we know how to understand the data, right? How are we performing? What's our baseline? What's the target that we're looking to achieve? Are we on the right track or not? What are our KPIs and metrics? Do we know the difference between a KPI and a metric? All of that's possible if we're data literate in healthcare and in the public sector. And lastly, it's not just about the data, right? So as leaders in healthcare, you probably find that you're not always the ones crunching the numbers, but you're generally the people who are looking at the reports, the dashboards, the graphs, and trying to make decisions on that. And so as a leader in the public sector, you'll find that data literacy is less computational, it's less about the numbers, it's more interpretational, it's more about what you do with that data, what action you take or what decision you make. And so being a data literate individual or having a data literate workforce will help you better make the jump from, say, just analysis to taking some action, or from deriving insights to making some measurable impact. And at UHN, we're trying to make measurable impact, so we want to be able to track the value that we're providing for any change that we make, right? And so our response to that, Ashley and myself on our team, is to start a data literacy program, and we call that our UHN Data Academy. It is a strategic underpinning of our data and analytics strategy that you see on the left-hand side of the slide, and we aren't doing this alone, right? So we are a very complex hospital network with 4 domains: clinical, corporate, research, and education. So we have partnered with our colleagues in HR, which we call people and culture, to make sure that we are helping our workforce adapt to this evolving data ecosystem, right? So they can change, the roles are changing, how they use data is changing, and how do we make sure that they not just survive, but thrive in this evolving data ecosystem, especially in healthcare, which generally speaking seems to lag behind, say, the private sector, but we are catching up pretty quickly. And this work is also aligned with our UHN strategic plan, which is to empower and invest in a very diverse team UHN to help them be successful, because if they are successful, we can have much more positive outcomes for our patients. So that's what it means at the bottom. The tagline is helping us become the best at getting better, and it's almost like a play on, it's a pun essentially, but being the best at getting better. So to be the best at getting better, really to help our patients get better, how we can be better is to use our data to help inform those clinical care decisions and hospital operations decisions, right? And if we are data literate as a workforce, then we can leverage our data to make some measurable impact, as I mentioned. And that's also helping us get better as an organization. And so Ashley's going to walk us through the 4 steps that we really went through to establish this program and get some value out of it.
Thank you so much, Andre. So we took 4 core steps when we moved forward with this initiative at our organization. So we started with assessing organizational readiness, and this is really building our foundations, our base step. After we understood whether or not the organization was ready to go down this path, we started establishing those strategic partnerships that Andre alluded to. We also developed our own strategy for the organization, as well as a recognizable brand identity. We then took a design for all approach. So we defined the data literacy skills and needs at the organization, and we identified pilot areas across the organization where we could actually start some targeted implementation to test out the products and services we were going to deliver to Team UHN. We then went forward and developed products and services with a focus for the majority as opposed to specific niche use cases across the organization. At every step in the way, we try to instill collaboration. So we focused on learners being able to create connections and build skills together as a team and bring in multiple different perspectives. We've also been, over the last fiscal year, reaching outside of our organizational walls to create connections with like-minded peer organizations that are going down a similar journey. And finally, at every step of the way, we assess and evaluate. We are constantly collecting our own data from the products and services that we put out there. We're evaluating whether or not they're sticking, working, are they actually leading to positive outcomes? And then we adjust and enhance those as we go through on an iterative cycle with all of our products and services, very much on the product management side of things within the educational sphere. So I'm going to go through each of these steps and provide a little bit more context so you can get a greater sense of the journey that we took within each of those 4, beginning with the building foundations. And this really started with organizational readiness. So often external factors or environmental factors to our organizations can push organizational readiness, and that really drives change. And we've seen this within our ecosystem. We saw this with COVID. We've seen this with changing resources in the healthcare system. We've seen this with a push to be more efficient, as an example, and we've seen this with a push for emerging technologies. So all of this external pressure is really creating an opportunity for change for organizations like ours in healthcare to be primed to take on a data cultural shift. And we're observing this within our own environment. We're seeing increased demand for data services. We're seeing the need to measure to reflect return on investment from initiatives that we're investing in within the organization. We're seeing this from a capacity planning perspective and wanting to use data for that purpose, and also to be more operational, more streamlined in terms of our operations and be more efficient. We're observing all of this. And when we saw that, we knew that UHN was primed and ready to take on this change within its walls. We then started establishing those strategic partnerships, and Andre alluded to this. So we really needed to focus on our core 4 core domains within the organization. So we engaged individuals across clinical, corporate, research, and education. And we identified key players at the very top to support us in terms of executive sponsors. It was very important that we established this governance at the beginning because we wanted to have a broad reach across the organization, and therefore we needed all those perspectives at the table to help guide us and advise us as we went forward with this implementation. We also created our own strategy, and we didn't do this in a silo. This was done very thoughtfully in context of everything in our environment around us. So we looked at the organizational strategic plan. We also have a strategic plan for data and analytics at the organization, and people and culture are our core partners in this work, and they have a strategy as well. So ours really had to be kind of that Venn diagram, that underpinning between these three, and we created a data literacy strategy for UHN with a 5-year roadmap that really gave us that underpinning to start creating like our specific product roadmaps and what we wanted to implement. After we developed that strategy, we needed to have a recognizable brand identity. So our brand is the UHN Data Academy, and you'll see the owl that's on the slide here. That is our mascot. So everyone at Team UHN sees the UHN Data Academy along with that owl on any materials or any support services products that comes out of the UHN Data Academy, and this reinforces within the culture who we are and creates that recognizable visual identity within the organization. After we establish these foundations, we really need to decide, okay, how are we going to support data literacy skills and needs across the organization? What do we mean by data literacy? So it was very important for us to work with those strategic partners to define what data literacy means for UHN. And we developed our data literacy framework that you can see on the slide here, and it really ties to 4 core data literacy skills or competencies. So that of data analysis, interpretation, data storytelling, and data-driven decision-making. This is our guidepost. All of the products and services that we have relate back to this framework, and it connects into everything that we teach, everything that comes out of us from an educational perspective. Once we understood that from a skills perspective and where we wanted to actually create some momentum and some learning within the organization, we had to identify our pilot focus areas. And Andre spoke to how large UHN is. We're an extremely large entity, so implementing something there can be very challenging. So we decided to focus on who were our natural change champions across the organization, and those are our leaders. So leaders within our organization, they are primed to drive forward the mission of the organization. They collaborate and influence their peers, and they also have a good perspective to bring down to their teams. So we knew if we were able to trial our products and services with that group first, they would be our champions and also help us enhance those, so it supported the majority at the organization. So we started there, and we've been building from implementing this with our leaders ever since. We then developed specifically what our products and services will be, and you'll see our product placemat on there. It's a collection of 10 different product and service categories for education across 3 major modalities. So the orange that there is all of our virtual training offerings that we provide to the organization. The green is any education that we do in a more of a community of practice or a peer mentorship space. And then the blue is specifically our in-person learning, so like an in-classroom training or like a learning lab that we offer to the organization. And this is our placemat. It is connected very readily to the skills and needs at the organization, to our framework. And it has those 10 different categories, 7 of which we've implemented to date. We've been moving forward with this on an iterative fashion, building out each of those 10, as well as tackling new categories as we move forward. At every step in the way, we wanted to instill collaboration. So we wanted to make sure as we were bringing learners together that we were helping them build skills together and helping them engage together in a comfortable way. And so one of the best ways that we did this is when we bring individuals together, we tried to help make sure that there were multiple perspectives that were brought to the table. You know, we often work in silos, but we didn't want the education to be in silos. So we started that collaboration early on across different players, across UHN, within our in-person training. And then we've extended that to scale and spread those best practices with peer networking and supports in a community of practice mode outside of the classroom. This makes sure that those engagements and those connections start with that that traditional setting and then extend outwards. And our hope with this and what we've been starting to see is that this relates to a behavior change. Often when you leave the classroom, some of the education stays there. We want to reinforce that back into daily practice, and creating those connections outside of those walls has helped us to start to see that result and that impact within the organization. We've also taken the opportunity to reach outside our own organizational walls, and we've engaged many peer hospitals that are on a similar journey, and we've been working with them to learn with each other and also share resources. And then finally, assessing and evaluating, this is something that we continuously do. We are data people, so we like to also collect our own data so that we can learn from that and really make sure that we're moving forward every single product and service and adding more value, or not spending our time somewhere where it's not valuable. We don't want to do that either. So we have provided opportunities for employees, for Team UHN, to really understand their own baseline. I always say that data literacy is a bit of a personalized journey. We all come in at a different baseline, different understanding. Some of us may be natural data storytellers, but maybe our data analysis skills are more rudimentary in nature. So we provide opportunities for employees to understand where their current baseline is. And most recently at the organization, we've implemented a data literacy self-assessment. This is an objective self-assessment that ties back to that framework that I spoke about and assesses skills across those 4 areas. This helps individuals understand where they are, and then they can personalize their learning journey from there and tap into the areas where they really need to support in terms of growth and improvement. We've also provided some fun opportunities for this, like a data persona. So this is a data personality test that we've just recently rolled out across the organization. It helps people understand their natural persona when it comes to data. How do they naturally react to data? How do they naturally understand data? How do they work forward and typically use data? It's a bit of a self-awareness tool and a great engagement opportunity for individuals to start understanding how data can support them better. And then finally, at every step along the way, especially within our virtual training, we provide quick quizzes, knowledge checks, opportunities for learners to test their knowledge as they go through the training and the educational products. Measuring impact for us is very important, and we actually use the Kirkpatrick model to measure impact. So this measures impact at 4 different levels, from a learner reaction to see if learning actually stuck with the learner. Do we actually increase our knowledge and understanding? Was there a behavior change outside of the classroom? And then also, are we seeing results, whether that's within the unit, the department, or the organization? So tracking back that impact. We also look at overall numbers in terms of flow to make sure that, we having a lot of people come to us in terms of referrals from peers that have gone through the program. And to date, we've supported 208 virtual users. We just launched our learning management system, our virtual tool, just this past June. Since then, we've seen 208 that have been interacting with us. We've been doing some in-classroom training a little bit longer. We've had 259 participate in our in-classroom training, and 630 have been supported through our community of practice and peer support networking events. And we always take that reflect and refine. So we collect that feedback, we put it back into our work, and we enhance as we go forward, especially as we start to broaden this across Team UHN. And so with that, I'm going to pass it back over to Andre. He's going to talk about the intersection between data literacy and AI literacy and how we're supporting it from that perspective at the organization.
So you heard a lot about data literacy just now, and at a basic level at UHN, we define it as, there's many definitions, but at the core, we believe that it's our ability to collect, manage, evaluate, and apply data in a critical manner, right? And in context. The data is always to be looked at in context. And that's something we do really well within the Data Academy that Ashley just walked us through. But we also know that AI is front of mind, and I think Erica mentioned this morning, or someone mentioned this morning. I think it's Erica. We don't want our executives, they all want us to use AI, but that's not what they're there for, right? They're there to make executive decisions, and we will make the decision on the right way to help with solutioning that, whether it's through advanced analytics, or maybe AI, or maybe data. But at a basic level, AI literacy in our minds is our ability to be able to understand, explain to others, and then also use AI tools and technology in an ethical way, in a responsible way. And so in our organization, while we focus on data literacy in the Data Academy, we have now at UHN, UHN AI Hub, right? And they are looking at all things related to AI and AI literacy. And what we didn't want to have happen in the organization is this disjointed messaging and confusion that would probably come out if there was separate messaging on data literacy versus AI literacy. They are connected, and they're two sides of the same coin, as we all know. And so this unified messaging, we work very closely with them. We were part of the AI Hub, and so this helps create a single messaging for the entire organization about the need for data and AI literacy. AI literacy is higher up on the journey for data literacy. It helps us bring the right subject matter expertise from all areas of the hospital network, not just from data governance and data literacy, but also from privacy, legal, our IT colleagues and digital colleagues. There are also colleagues in specific areas like orthopedics or surgery. They're all using robotics and things. And so how do we bring them all together to make sure that all the tools and resources we're building around AI literacy are all connected, they're all integrated in the right way, and that together we can evaluate the readiness of UHN for specific branches of implementing AI. And on the right-hand side of the slide, you can see the 5 key things. It's still early days for us at UHN, but these are 5 key things which I think are basic for any organization to have if you are going the route of data literacy to AI, towards AI literacy. One is we have a collaborative center. So that is our source of truth for all the 37,000 employees that we have or staff at UHN to get resources to do with AI. Right? We also have something called AI rounds. So this is from our medical rounds that we do with learners that come into the hospital, but now we call it AI rounds, where we have virtual learning, almost the community of practice that Ashley mentioned, where we go through evolving trends, maybe discussing articles or things that people have implemented in healthcare, but also in other public sector companies, and also in the private sector that we have a lot to learn from. We also have implemented an AI resource library, so this is really a library of all the different courses, sessions, webinars, and articles and resources for our organization's workforce to learn about data and AI literacy. And so everything that we build related to data literacy that has some connection to AI, so for example, we teach our workforce how to use generative AI tools to help with their daily work and to help with that in being more efficient at their jobs as their roles evolve. And so that's part of AI literacy, and so that's part of the listing of resources in that AI library. And then, of course, AI education. So we have standards, guidelines, policies. Healthcare is heavily regulated, and so we continue to evolve what the AI regulations are, along with the ministry as well, but they're all available centrally for everybody to access. And lastly, it's the expertise, right? So we have what we call an AI readiness an education working group with representation from all those different areas that I mentioned. And that's all the subject matter expertise to make sure that everything that we implement and create for the organization is valuable to all those different domains that Ashley talked about, but also that it is connected and that there's synergy between what we're actually talking about. And lastly, I wanted to leave you with these. I won't walk through every single one of them, but as human beings, we're not wired to make decisions based on data. We make decisions based on our emotions and our feelings, right? And so you can have all the data in the world. You can tell me it's very important to drink 8 glasses of water and walk 10,000 steps. But do we have the data? Do we really do that? No, because there's many reasons why we make those decisions not to. And so it's important to help your workforce understand that this data is all available. It's not shoved down their throats, but it's there to help them make their decisions and inform those decisions when they're doing patient care, when they're involved in hospital operations, or anything of that nature, right? And so we talked about scaling out your data literacy program, starting with basic foundational data literacy, and working your way up, making sure there's representation from different areas of your organization if you're trying to create products and services that the rest of the organization will be using as well. It's very important to measure the work that you're doing so that you can actually show value back, especially if you're funded publicly by a ministry in any way. And at the end of the day, it's really to help build those strategic partnerships that you need in your organization to make sure that your data literacy program is successful. So thank you, and I don't know if we have time for questions, but happy to take any questions even offline.
Well, thank you so much, Andre, and Ashley there as well. Thank you. So that's wonderful.